Hi, I'm Gail from the Nurses Station. Welcome to Nursing's STEM Initiative. This presentation is about how to locate a healthy vein with respect to IVs, the venipuncture, and the infusion. So let's get started. Quit strangling the vein with that tourniquet. If you only knew how fragile that vein was, we would be treating it so differently. You can see here from a cadaver anatomy dissection that the vein looks very frail, and it is. Very thin-walled. There's not much to it. Vein blocks give us the perception that it's a very thick-walled structure. It's not. So that's why we need to have this exposure to the educational process of vein access that we don't currently get in nursing school or any other academic program. So every person who inserts a needle into a vein needs this cadaver anatomy and needs graduate physiology before they stick. And none currently do. We're going to fix that today. We're going to give you the information that's missing from your training programs. And because this isn't required in any of the training programs or on-the-job training, we're all left with stick and hope you hit something and keep sticking until you do, as the current method of instruction. Well, that's not good. In fact, that's a malpractice. Mal meaning bad practice, but it can also be legally a malpractice and will be in the future. So we need to change that. How are we going to change that? Let's go to the next section. Okay, to palpate using the pad of your dominant hand index finger. Always the pad, never the tip. The first thing that I want you to do is place the pad on the table and tell your brain to notice it. Next, if you were resting your arm or hand or fingers on any other part, I need you to lift all those up so just the pad is touching. Because if any other part of the arm or hand or any part of your human tissue is touching anything else, the brain is getting a touch signal from all those other spots. So place just the pad and feather light. We're not trying to press through the table, just feel the table. Now we're going to feel what the vein feels like. So here's a long, skinny, not over distended water balloon. I place the pad on it and gently press up and down. Pad must stay in contact. In other words, no tapping. Stay in contact, depress, release, and gently. If you're feeling the table, you're pressing way too hard. So press, release, and that is what a vein feels like. Now, to determine that the direction of the vein, you line this water balloon up the same direction as your finger. Now place your pad. You can feel the water balloon and therefore the vein the entire length of your pad, and now you know what direction the vein is going. But it must be a non-over-distended water balloon to appreciate what a normal vein feels like. And that's the corollary, and that's how simple. Hi, I'm Gail from Vein Access Technologies. I'm going to ask you a question. If somebody were to smack your face, does your face lean in and say, hit me again? No, the face withdraws. And that's because the skin on your face is innervated. And in response to pain, it withdraws, contracts. Your vein wall is innervated. You may not know that. So when they smack, slap, flick, or tap during a venipuncture to raise your vein, they are actually causing vasoconstriction, not dilatation. So see the VAT method at vatmethod.com for how to properly dilate a vein, the gentle way, the VAT method. So we want a vein that's not only visible to see, but actually raised up off of the arm. And then we glide palpate and experience what feels like a water balloon bounce. And what we just did here was we prepped the arm with 70% isopropyl alcohol and we left it wet. Because when you read the instructions in the book on how to locate a healthy vein, it teaches you that we are going to palpate wet with alcohol, feeling for that long skinny water balloon using the pad of our dominant hand index finger. The alcohol prevents friction, which then produces a clear touch signal, not a noisy touch signal. If you palpate dry, you create friction, and friction creates grab and drag, and that is noise to the brain. So you just witnessed how to palpate wet to locate a vein. I'll teach you how to dilate that vein without a tourniquet, using the same gentle touch VAT method. So first, let's recall, you're going to use the pad of your dominant hand index finger. You're going to wet the area with 70% isopropyl alcohol. And then you're going to glide palpate to locate it. And when you do, press palpate it to confirm that it is a vein. It will feel like a water balloon bounce. Okay, we're going to get that same arm again, and we are going to wet the region. So prep it with your 70% isopropyl alcohol and leave it wet. And the first thing we're going to do then is glide. And once you've located it, palpate it. Yep, water balloon bounce. Continue to palpate for 7 to 15 seconds. This will naturally dilate the vein to the size nature wants it to be, not an overdistension. And again, note, we have not used a tourniquet. So 7 to 15 seconds of gentle press palpation will relax the muscle in the wall of that vein and allow the vein to fill to the size nature intended. Wasn't that a much better way to dilate a vein than with that mean tourniquet? Now I want to show you this palpation technique using a vein block, because that's frequently used in training programs. They use it to stick these structures with needles. And we'll go into that later in a different video, but no, this won't serve that purpose well, and I'll be telling you why later. Right now, we're going to use it as a palpating tool. Hi, this is Vein Access Technologies short video clip on how to locate a healthy vein. Before any venipuncture procedure can be performed, a vein must be located, but it can't be just any vein. It must be a healthy vein. And we know that the current methods for locating veins just aren't working that well. So this short clip is going to just do a very brief introduction to the new technique for locating a healthy vein. Taking a vein block, that has dimension. So in other words, the veins are palpable, not just visible, they're palpable. You can feel them.
It's okay.
I'm going to teach you how to locate one with this new technique. First, I want you to experience what it is to palpate dry with just your finger. And we're not going to use a glove. We're going to talk about that part of the story later. You can see the grab and drag. That's called friction. And when you have friction and grab and drag, you don't have a clear touch signal. And if you were to close your eyes and do this, you'll feel two bumps, but that's about all you can discern. But we're going to palpate with alcohol, 70% isopropyl alcohol, the alcohol that's already out there in every wipe in the world. When you use alcohol, the alcohol prevents friction. And now you can glide. No more grab and drag. And you want to glide as light as you can. And you're using the pad of the dominant hand index finger to palpate with. And this is called a glide palpation. When you do that, you can not only feel them easily, you can tell how tall it is, how wide it is, and where it ends, and realize that this other one is a bigger vein. So alcohol enhances your sense of touch. And we're feeling for long, skinny water balloons beneath the surface of the skin in the subcutaneous tissue. And if the veins are deeper so that they're not visible, you can still glide because 80% of them will still be palpable by gliding. But if they're deeper yet in the subcutaneous tissue, then we're going to pick one side or the other of the arm. And with small increments, press palpate your way across the region. And when you find a vein, it feels like a long, skinny water balloon bounce. Or when you feel the long, skinny water balloon bounce, you have located a vein. And again, gentle, gentle, gentle. That's the first step in how to locate a healthy vein. As I mentioned earlier, a healthy vein is dependent upon more than these procedures and techniques. There are characteristics that we need to know about the vein because not all veins are created equal. So we'll see this next description in a second here. Hold on. Okay, veins need to be graded on these four characteristics: firmness, size, direction, and depth. Firmness is not how full the vein is, how big. Firmness is the wall thickness of the vein. And recall the diagram or the picture of the cadaver vein, very thin. Well, vein wall thickness varies throughout the body. In fact, as veins get closer to the heart, the walls get thicker. That means the veins in your hand are the thinnest walled veins in the body. And when you take this course, we have a method for teaching that, so you will know about vein wall thickness and how to grade it. And then size of the vein tells us which size needle we need for the lumen size of that vein. Direction, and then depth, because veins come in three depths: shallow, average, and deep with a little d. I use the vein block to teach that technique as well. So some of this can be taught here, but some of this must be hands-on in a training program. Now, why is all of this important? Well, because what we do, everything that we do externally to that vein has an impact on it. So let's see what the tourniquet does to it. The tourniquet causes hemoconcentration, period. That's a scientific fact. So if science can show how to avoid the use of the tourniquet, why isn't the medical profession listening? And here's the science. It's not my science. Ernest Starling in 1896 described venous circulation, venous physiology. And the reality is, as you can see from the diagram, vein walls have a normal wall thickness depending on where they're at in the body, because vein wall thickness varies throughout the body. That's another class. But when the tourniquet's applied and that forced over distension of the vein occurs, the wall thins. And when it reaches a certain degree of thin, it leaks. The venous system leaks. And as the fluid leaks out, that's called infiltration, exudation, transudation, a lot of names for it, but it leaks. And when that happens, constituents left behind that you're going to be testing with your blood tests, the blood cell counts, glucose level, certain lab tests then are falsely elevated because as fluid is leaking out, the concentration of the constituents left behind increases. That's called hemoconcentration. Scientific fact, not my fact. Many papers have been written on this subject, and not by me. This one is by Lippi et al. So pull this one up, read it, look at the references at the bottom or the bibliography lists associated with it, and you'll find other articles. So even at the end of theirs, they said, you know, what can we do here? So prompting further considerations on the usefulness of adopting appropriate preventive measures for minimizing such influences. What could that be? Well, I have a solution. It's called the Veni cuff. The Veni cuff. It's a biomedically engineered tool that inflates to only 20 millimeters mercury pressure. Think about that. The tourniquet's on anywhere from 80 to 220 or higher millimeters mercury pressure, as much as a pumped up blood pressure cuff. Well, this 20 millimeters mercury external pressure to the vein supports the vein and the venous system. So we do not create the infiltration and hemoconcentration issues. This is the tool that needs to be used on every venipuncture, radiology, nursing, laboratory medicine, and including the EMS people. So this pressure thing is not only important from a tourniquet perspective, but when you're palpating, how much externally applied pressure can you put on that vein with your sense of touch? Now that you know that the vein itself has a blood pressure of 20. These are the things you'll learn in the training program. And we have a way for evaluating and assessing what your normal grip pressure is and how much pressure you would be applying with palpation. All new information, all new technique, critical to actually doing this right. So we need to learn it, we need to know it, and you need to be taught it. So again, quit strangling the vein with that tourniquet. And let's use a new method for locating veins rather than forcing an overdistension to locate one. Keep in mind that the vein is fragile and we need this anatomy and physiology education. Plan on attending a conference if you can. I hope you enjoyed this presentation on how to locate a healthy vein in this nursing STEM initiative. I hope you learned some new information, some new technique. I hope you will try it. And when you're successful with it, I hope you will come back to learn more. And if you can, please attend one of the in-person training programs. You'll be glad you did. Okay, here are the questions. So screenshot it and then save it and then copy paste, put it in an email to me. Answer the questions and then send it to us and we will send you your CEs. Thanks.